Hello everyone, I'm Dr. Chandan here. Today I'm going to share you the most important topics in pediatrics which you must know. Guys, pediatrics is very important and very scoring subject and you can easily memorize and remember the topics in pediatrics. Guys, I went through the last 11 papers of FMGE and I have selected the topics which are repeated in multiple exams and which are expected to be asked in upcoming exam. So please make sure you don't miss any of these topics. So let's see the topic. The first one is mid upper arm circumference. It is extremely important. You should know the cutoff value for red zone, yellow zone and green zone. Then we have disorder of height, like we have familial short stature and we have constitutional delay in growth and puberty. And next we have contraindication of breastfeeding in neonate. Means what are the absolute contraindication when the baby has certain condition to breastfeed, and what are the absolute contraindication when mother has in some condition. You should know this very well. Next we have Kwashiorkor and marasmus. It's again Kwashiorkor is very important. And we have acute and chronic malnutrition like wasting and stunting, that is like height for weight, which is acute, and chronic malnutrition which is like for height for age. It's also again very important. Next we have Menkes disease and Wilson's disease, very important. And we have like acrodermatitis enteropathica, which is a disorder of zinc deficiency. Then we have Leishman disease. We have Hanoch-Schondle purpura, again which is IgA vasculitis. It's also very important. Now we have diphtheria, varicella and cytomegalovirus, again very important. Measles, mumps and rubella, definitely you should know this. Erythema infectiosum, again parvovirus B19. Hands, foot, mouth disease, very important. HIV in children. In HIV in children, you should know the treatment also. What if mother is on treatment and what if mother is not in treatment. And neonatal resuscitation is again very important. In neonatal resuscitation, you should know what are the indication to start a positive pressure ventilation. Okay, what are the when we have to start a chest compression and when we have to start a adrenaline injection. When we have to by looking the heart rate parameters, this is also very important. And neonatal jaundice, we have APGAR score and Silverman score also. This APGAR score is very important. And they will give the image of the chest x-ray findings, and by looking at the chest x-ray we should able to identify whether it's a tetralogy of folate or transposition of great artery or total anomalous pulmonary venous connection or coarctation of aorta, or it's a abstinence anomaly. We should able to identify in the chest x-ray findings. Next, diarrhea in children, which is caused by which organism, and the treatment for dehydration is also very important. In some dehydration, in severe dehydration, the treatment is again very important. And next, they will give the case scenario where they have been mentioned the fast breathing rate, and they will give either the clinical feature of chest indrawing or danger sign is present or not. By looking at this, we need to identify the diagnosis, whether it's a case of pneumonia or severe pneumonia or simply the cough and cold. And we need to know the treatment protocol also for this condition. Next, we have nephrotic syndrome, where minimal change we need to know. In nephritic syndrome, we have to know PSGN, post-streptococcal glomerulonephritis, again extremely important. Next, we have to know anencephaly and ultrasound findings also. And we have status epilepticus, which is very important, as well as febrile seizure also you should know. And absent seizures. Now we have congenital hypothyroidism. We have congenital adrenal hyperplasia, which is also very important, and Duchenne muscular dystrophy, it's also very important. And you should learn about milestones, because there will be multiple exams. They have been asked milestones like in 2 or 3 questions. So know about milestone, which is also very important. And Congoro mother care, know about it. And cephal hematoma as well as caput succedaneum is also very important. And guys, like the topics of in pediatrics with like the genetics part and the glycogen storage disease, disorder of amino acids, lysosomal storage disorders, this I covered in biochemistry. That's why I did not highlight it here. and at the same time croup, laryngomalacia, epiglottitis, this also I have covered in ENT, so take a look over there. And hematology part also I have covered in pathology, and some GI part is also I covered in surgery, so I have not mentioned here. So please make sure to revise this topic also very well. These are the very simple topics, and you can easily answer question from these topics, so make sure you learned and remember well. Thank you.